Here's our agenda for today. We'll do some quick intros of our team for any new staff on the call. We'll give an overview of the organizational assessment with some remarks from the Office of Health Equity's Deputy Director. We'll walk you through the SurveyMonkey to complete the annual assessment and give you a timeline with some key dates. Then we'll open up the floor for any questions. You can also put them in the chat as they come. As many of you begin or continue to grow your staff, we wanted to take a moment to welcome you and introduce our team. To start, we have Stephanie Pisano, our wonderful technical assistance manager who oversees our TA team. I'm Selena, the TA specialist for the Bay Area region. We also have Haley Need, TA specialist for the rural North/Northern California region, Claudia Medina, TA specialist for the Greater Sacramento region, and Jessica Medina, TA specialist for the Southern California region. Our former TA specialist for the San Joaquin Valley region recently accepted a new position, so all LHJs in this region are currently split between the TA team, but we are actively hiring and recruiting for a new TA specialist. You can reach out to us via inquiry through the Equity portal. So our webinar today will focus primarily on the organizational assessment for equity infrastructure. This may be a tool you're familiar with, or it may sound new, so let me give you a brief overview of what it is. The org assessment was a tool that was developed in 2022 by the Equity TA team and our CDPH partners at the Office of Policy and Planning for local health jurisdictions to collect baseline data on current equity infrastructure and use it to inform planning for future equity. We received a total response of 59 out of 61 surveys from you all, our local health jurisdictions. I'll talk a little bit more about the 2022 results in just a moment, but I'd like to first turn it over to our Deputy Director from CDPH's Office of Health Equity to talk to us a little bit more about why the organizational assessment matters. Dr. Rohan Radhakrishna, I'll turn it over to you now. Thank you so much for being here.
Thank you to the Equity Technical Assistance team, to all of our equity leads across California, from north to south, east to west. I'm honored to be with you today. My name is Rohan, and I stand for love, dignity, and transformation. A key part of my role as the Chief Equity Officer for the California Department of Public Health and a Deputy Director leading the Office of Health Equity is to support all of you. I spent 10 years at a local health department back at a time where equity was emerging, was sprouting, was being planted and fertilized in some parts of our state, but never before have we reached this level of momentum for our movement, where we now have 45 out of 61 local health jurisdictions with designated equity leads. I'm so proud of how far we've come and really honored to be with all of you on this journey. I first want to start by thanking the Technical Assistance Equity team, Stephanie Pisano, our manager, and all of our regional TA specialists. They are there to support you. That is one of the primary missions of our department and office. We know that equity work happens at the local level, at the community level. And so this assessment is really a way for us to track our progress and momentum together. I'm going to start with the sales pitch, which is why this assessment is so important, both for you at the local level, but also us at the state level, and why going through this annual ritual of seeing where we're at, where is the needle, how much have we moved the needle, is so important for a variety of reasons. And then I'll talk about the broader landscape from federal to state to the local level and how you all fit and are a key part of that broader fabric that we're weaving for equity in the United States. Let me start by naming that data helps us to tell stories. This is the story of a growing equity movement in California through the pandemic, before, during, and after, and having baked in, hardwired in, a local equity lead, just like there is a tobacco control lead, a nutrition, education, and obesity prevention lead, a tuberculosis controller lead. We are now in the 2020 decade where to really deliver on equity, every county needs and deserves, no matter the title that the person has, a designated lead that is that go between state, regions, and localities, and between all parts of county government and the health department to deliver on equity. We learned a lot of lessons during the pandemic. A lot of other sectors are turning to us, and supporting you all at the local level is so important. And data helps us tell that story of the landscape of California. Data is also power. When it's representative, it's more powerful, and it helps us advocate for resources. When I go to our Secretary of Health and Human Services, the largest agency in the largest state, and I say, Dr. Galley, last year, 60 out of your 61 local health jurisdictions took this assessment. We have high fidelity and confidence that this is where we are, and this is the direction that our localities want to move in. These are their top 3 out of 12 competency priorities, and we're going to support them and deliver on that with this gift that we have from federal COVID funds and from state general fund, but our commitment is to bake it in for the long term. We want to show you their priorities and how we're moving the needle. That data can be very powerful at the state level and the local level to deliver and request the resources that are needed to sustainably build infrastructure to do this work. Finally, this is all part of building and increasing our ongoing equity capacities and competencies. We believe in continuous improvement, so no matter our starting point on that scale of 1 to 6, if it's a 1.5, a 2.5, a 3.5, or a 4.5, we all approach this work in the spirit of continuous improvement. And knowing if we're moving the needle or not is helpful, so we know where to focus our time, priorities, and resources. So we really thank the 60 of you that completed this last year, and ask for all 61 local health jurisdictions to take the time to complete this assessment before the end of June 2023, so we can further continue our work to support all of you. I have shared this presentation with all of your county health executives, with all of your local health officers, and with all of your directors of public health nursing in presentations over the prior weeks. I'll be presenting it to the Secretary later in May, and I'm honored to be able to share this landscape view with you all today. Next slide. So we find ourselves in this equity moment that I talk about needing to turn into an equity movement. And this slide shows the breadth and the depth of equity infrastructure. Let's start at the federal level and how lucky we are to have an administration with Biden and Harris that on day 1 created an executive order on advancing racial equity and supports throughout federal government. 90 agencies created 300 concrete and intentional actions to address systematic discrimination, oppression, and racism in our government and to promote shared prosperity nationwide. That was followed up this February of 2023 with the second executive order, getting much more specific about operationalizing it with action plans that are made publicly available. Here in California, in September of 2022, Newsom put forward an equity executive order that calls for all agencies and departments to embed equity in their strategic plans, to have a racial equity commission that will be housed at the Office of Planning and Research. And within our agency, we are championing chief equity officers, but we have one now at the government operations level, which is great since they oversee a lot of the policies and procedures from contracting to hiring and data within state government. Within our Health and Human Services family agency, we have made this a North Star since the fall of 2021. We have now on board for the first time ever an agency chief equity officer, Dan Torres, and I hope he gets to meet all of you with our fall convening where we'll get together in person. All 17 departments and offices, from public health, myself, to social services, to healthcare services, has a designated equity officer, just like you all are building equity leads and teams within your local health jurisdictions. And we have a committee within our Health and Human Services Agency dedicated to justice, equity, diversity, and inclusion. We have an equity dashboard that is putting forward equity impact goals, and you should all know that you all were elevated to be an agency equity impact goal. We knew coming out of the pandemic for an equitable recovery, it was essential to have permanent, sustainable local equity infrastructure, leads like all of you and your teams. So our agency agreed that will be a top priority, and we're tracking it. So by next summer of June 30th, 2024, our goal is to go to 55 out of 61 local health jurisdictions having dedicated equity leads. We've made great progress going from single digit to double digit now to 45. And this assessment is one way to track that ongoing progress. Within our department, we have Director Aragon's priorities. Of course, our office, 11 years in statute, championing and supporting equity across state and local government. We've cross-pollinated and supported equity liaisons within the other centers and divisions. Communicable disease, environmental health, family health, all have equity liaisons for you to interact with as well in specific programmatic areas. And we have our HEART initiative, Healing Equity, Anti-Racism, and Trauma Responsiveness for Transformation. Now, within the Office of Health Equity, we have grown tremendously since our original statutory mandate and now have 6 branches and sections with dedicated support teams such as climate change and health equity to support specific areas at the local health level, along with this great equity TA team within our Advancing Community Equity branch. We look forward to a convening later this fall to meet with all of you in person and partnering with the Office of Policy and Planning on our State Health Equity Plan, or the SHEP. Now at the regional level, you've heard the launch of our Regional Public Health Office, with California really being the size of many nations, the importance of regionality, and us supporting many of those regions with technical assistance dollars for specific things like data or training. And we will share the calendar of all of those deliveries based on the priorities, again, that you shared on that assessment. So for us to be able to pivot our future offerings and resources and technical assistance, hearing year after year, so we can make micro adjustments is really important. And finally, at the local level, you all are really the hearts, the hands, the brain behind the equity work, embedding and implementing it at the local level. So not only in supporting an equitable recovery, but getting that permanent infrastructure in place is what this is all about. Next slide. This is another way to describe these overlapping communities of practice. We describe it as an ecosystem of equity communities of practice. At the national level, we have organizations like the Government Alliance on Racial Equity. California Department of Public Health was an early adopter within state government back in the mid-2015 era of bringing that into state government, now partnering with Race Forward. At the national level, we have many offices of minority health and health equity. I represent Region 9 in California, and there's ASTO, the broader association of state, tribal, and health officials that are also embarking on equity work, the federal equity plans that I mentioned, and CDC has rebranded and restructured and now has an Office of Health Equity, and we contributed a lot to some of their thought partnership around their restructuring. This photo in the bottom left is of me just last week at the CDC in Atlanta with one of our advisory committee members, Wei Yu from CPEN, the California Pan-Ethnic Health Network, to really also talk about the power of partnerships with our community organizations and coalitions. And I have the honor to represent California and learn from other states how they are embarking on equity work. And I'll share. I didn't even know that people from Utah came up to me and said, "Thank you so much for the org assessment. We saw it on your website. We've been using it in the state of Utah to all get on the same page, get a baseline, and know what the needs are." So your hard work has paid off and is paying dividends across the United States and informing and inspiring other jurisdictions at the state and local level to similarly take inventory of their infrastructure, their priorities, and where they are on the spectrum of continuous improvement with equity infrastructure and competencies. In orange in the bottom, you can see many of the state partnerships. We are one agency that participates in an interagency group called the Strategic Growth Council, whose mission is to create thriving, healthy, sustainable communities by addressing those upstream built environment challenges like housing and transportation and food. And we get to share all of the equity learnings that you all are implementing at the local level with other agencies. This supports our broader health and all policies work through the task force that we're a part of. We have our agency community of practice with the JEDI, and we are also continuing to train all of our equity leads by participating in CORE, the Capital Collaborative on Racial Equity. Finally, we have our OHE Advisory Committee, a 26 public member advisory group that meets quarterly. Within CDPH, I described our HEART initiative, which is part of becoming a healing organization, our cross-pollinated infrastructure. We don't want it to be siloed with one office or one officer because equity needs to be baked in, and several program-specific initiatives. And at the local level, we have what we're here to discuss today, building and supporting equity infrastructure through technical assistance through all of you, and our state health equity plan and SERI, our California Equitable Recovery Initiative. Next slide. So through the pandemic and the CDC's COVID-19 Disparities Grant, we started to fund both at the state and local level equity infrastructure. That was for a few years, and we heard from you, we need longer term, more sustainable, multi-year funding if we're going to bake in these positions. We're grateful to have had a second opportunity through the CDC's infrastructure grant with California named as CASP, California Strengthening Public Health Infrastructure. This is a partnership between our Regional Public Health Office, our Office of Policy and Planning, and our Office of Health Equity. And what you'll note highlighted here is that every local health department, in order to receive this funding, is required to have one full-time equivalent dedicated to equity. No matter what it's called and what jurisdiction, we know we have to use different terms. We have a very diverse landscape. We want to honor and support that, but we're here to do the work collectively and support you within the regions and localities. We also changed our equity funding formula to model and practice distributional equity. We heard loud and clear that not all counties are the same. We can't just go based on per capita. So we modernized our formula to take intra-county disparities, both for poverty, as well as factoring in race and ethnicity. So you could compare yourselves to yourselves and note the disparity gap that you needed to close. And that allowed for more distributive funding and smaller counties to get higher amounts of funding with a floor of 567,000 as you're seeing here. But most importantly, it allowed that commitment that if you're not already funding a dedicated equity lead, here's yet another opportunity to do that. Next slide. So I'll end by talking about the state health equity plan. You all at the local level have CHAWS and CHIPS, community health assessments and improvement plans, and we do as well at the state level. We're trying to bake in equity permanently for the long term by centering it in our state health equity plan. And this org assessment is a key part of that. You may have seen presentations and hopefully participated in our engagement around the SHEP that allows us to align our state and local strategies in a common equity framework with 4 domains. One of those domains is called equity infrastructure, which is about that asset and capacity building in order to support LHJs advancing equity over time. And so this organizational assessment is key to the SHEP because it provides that continuous improvement and documentation so we can recalibrate our equity-focused strategies and actions to improve outcomes and ultimately sustain the systems level change. So with that, I'll pass it back to our team to go into more detail about the assessment, the methodology, the priorities, the competencies, what we showed last year, and what we need from all of you and the various options for how you can conduct that survey by the end of June to continue showing where the needle is and how we're moving it. Thank you so much for all that you do, and I'm open to answering any questions you may have now and also at the end of our session.
Thank you, Dr. Radhakrishna, for that. Stephanie, do we have any questions in the chat for Rohan that we can answer before we continue moving along? Just wanted to take a moment to see if anyone has any questions to ask here.
None in the chat, but we can take a quick moment to see if there's any hands or mics have been unmuted, so you can feel free and unmute yourselves. Okay. See none.
All right, let's keep moving then. Again, thank you so much, Rohan, for that wonderful presentation. It's always so great to hear from you. I want to talk now about some of the specifics of the assessment and the past results to ground us before diving into the 2023 assessment. The assessment is broken down into 4 domains overall and 12 competencies, 3 competencies per domain. These were informed by a 2021 survey where local health jurisdictions were asked how they would like to complete the assessment. Our team then extensively reviewed other frameworks and assessments developed by subject matter experts, including GARE, Human Impact Partners, and our regional partner, BARHI. The assessment is not meant to be exhaustive. We understand that each jurisdiction is in a unique position with different levels of resources and community-specific considerations. The annual assessment is now meant to continue dialogue and monitor the progress of each local health jurisdiction in the state. If you have any questions about the domains, the competencies, or the assessment in general, feel free to put those in the chat. As mentioned, there are 12 competencies total. Each one is measured by 3 levels of progression, early, established, and strong on a scale from 1 to 6. As the assessment is being completed, you're asked to self-select the number in the level you believe your jurisdiction most aligns with. There are also non-exhaustive examples in each competency of what it could look like for an organization to be in the early, established, or strong stage of that competency. The intention of the assessment was not to evaluate or judge your work and efforts. Our team wanted to gather as much baseline data to get an overview of the current equity landscape. We want to emphasize that early is not synonymous to bad, and strong does not necessarily always mean good. There's also no specific approach to completing the assessment. There are various strategies to taking the assessment. Briefly going into the state results, we were able to gather the average domain scores for all 4 domains based on your individual scores. Domain 2, collaborative partnerships, had the most development with an average score of 2.64 out of 6. The competencies in this domain include structures to build collaboration, CBO and resident engagement, and partner across sectors. Domain 3, equity and organizational policies and practices, had the least development with an average score of 2.16 out of 6. Competencies in this domain include data collection and usage, shared analysis, and inclusive decision-making. These are areas where more challenges tend to arise, there's less resources, or resources that aren't as specific. With all 4 domains having an average of just over 2, we can see that the state is fairly early in terms of its equity infrastructure. The data is also varied by region and individual local health jurisdiction. I encourage you to view the 2022 results report to learn more about where we were a year ago as we get ready to complete the assessment again 1 year later. We also want to note that the results indicate lots of opportunities to improve and progress within the domains. This is evident over the last year, especially through the SERI grant. As one of you eloquently phrased it in the past, the scores don't mean anything. It's the work that counts. We don't want you to feel discouraged seeing these scores or your individual scores. These are just the baseline results, which will change over time. For 2022, as part of the assessment, local health jurisdictions were asked to self-select 2 to 3 competencies to improve on. Based on the results, training, development, and support, embed equity principles, and inclusive decision-making were selected as top 3 priorities for the state. We will continue to provide our technical assistance services and modifying them periodically based on your needs and feedback, as well as the 12 competencies of the organizational assessment and the priorities you all selected. After looking through the data, we really were able to streamline our services and tailor them to what we were hearing. In addition to the results report, we held 32 individual consultations with you all to talk through your scores and set some goals. We re-evaluated some of our TA priorities and developed ongoing monthly newsletters, which include links to training opportunities, resources, and spotlights of equity work happening in other counties. We hold our monthly optional office hours where we try to incorporate topics based on the competencies, and we bring in speakers that can share insight to common challenges we all face and provide a safe opportunity to peer network with other jurisdictions doing similar work. We were able to develop the equity toolkit that you can use in alignment with the organizational assessment. It includes a mixture of resources also based on input from you for the 3 different levels of the competencies. We also plan to release updated versions of the toolkit in the next 3 to 6 months and encourage you to look through it and let us know what else you'd like to see or how we can improve it. As a result of the 2022 baseline assessment, we now have a variety of upcoming TA activities based on the influences of your results and the feedback you've provided us and our regional partners. There are trainings, workshops, and virtual convenings, and there's also more to come, so stay tuned for that. With all of this being said, I'll now turn it over to Claudia to walk us through the annual assessment.
Thank you, Selena. So we now want to go over the main components of the assessment. What you will see in the SurveyMonkey is a definition of the competency, along with some examples underneath for each category. Then there is a comment box below for each competency that has been slightly reworded from the baseline assessment, which is please share any additional comments about your choice above, challenges, barriers, or successes and wins. A concern we have heard from LHJs is that their progress and work will not be reflected if your scores do not change. Well, the optional text box underneath each competency is a great space for your LHJ to explain your reasoning for choosing a particular level and provide progress on each competency, even if your assessment number remains the same. So accurately answering on this assessment will allow us to identify priorities for technical assistance. We understand that equity work takes time, and we are expecting that to be reflected in the assessment results as well. We also understand that you may even go down in scores for a certain area, and we want to assure you that that's okay if it happens. We would like for LHJs to be honest on this assessment so that we can get an accurate representation of where California is on this equity journey. There is no consequences, nor does it impact funding if your LHJ goes backwards on the scale. Next slide, please. So the other main component of the assessment after you select your scores for each of the 12 competencies is going to be a post-assessment reflection, where you select your equity goals by selecting 2 to 3 competencies your LHJ would like to improve on. Then you can mention some of the strengths your LHJ has. And then the last question is a new required question, where we're asking LHJs to describe how your LHJ conducted the assessment. This is a space where you can mention if your LHJ changes methods from the baseline. In the next couple of slides, we will go into more details about changing methods. Next slide, please. So now I'm going to show you a quick SurveyMonkey walkthrough of the assessment and let you know some things you can and can't do in SurveyMonkey. So Selena, if I can share my screen. Thank you. All right. So when you click on the SurveyMonkey link, this is what you're going to see. You're going to click on next. And then it's going to ask you to fill out some of your information. I've already filled mine out, so you'll see this is already populated. But you'll select your LHJ, your region, and then it asks if your SARI or CDC health disparity funding level. You can click on that. And if you decline funding, there is an option here that says no funding or decline funding. So you fill that out. And then the next thing is there's going to be a little introduction of the assessment. You can read that and click next. And then also there will be instructions about the assessment where you'll see the scale again and what each number represents. And then it asks you here to please select 4 if you understood the instructions. So you'll click on that. And then now you actually get to the assessment. And so one of the things that we shared with you all is a Word doc version of the assessment. So a tip that I have for you all is if you want to fill out everything in the Word doc assessment first, put in your numbers, putting your optional comments in there so that when you do open the SurveyMonkey, you can just copy and paste everything over. And I think it's a lot quicker if you do that. So I've kind of done that here. I've filled mine out. I've added here some additional information. One of the things too, as you're working on here, you'll see that, the little star means that you have to actually fill this one out. And then the ones that don't have anything means they're optional. So you can fill those out. You can click next. In SurveyMonkey, it doesn't allow you to skip forward and jump around. The only thing it does allow you is to go back because, like I said, you have to click on all these ones with the star in order for you to move forward. So I can totally go back if I want to in case I accidentally put the wrong number. I can go back and change this to this and then move forward. So I'm going to go through it since I've already filled it out just to get to towards the end so you can see. And again, at each one of the pages, it'll show you the scale at the top too. So you can always have that as a reference as you're filling it out. And then keep going here. And so then the last thing is the post-assessment reflection, like I just shared. You select your 2 to 3 your LHJ wants to improve on. And then there's an optional question of you sharing your strengths. And then here's the box where the new question we added, where it's asking for LHJs to show how you conducted this assessment and completed it, and if your methodology changed. One of the other things too, as you're working in SurveyMonkey, is if you want to stop and go back to it at a later time, it does save your responses and it does stay where you left off. So if I needed to go do something else, I could close it. And then when I click back on that SurveyMonkey link, it does open up and it has everything already saved for where you left off. And then just a friendly reminder, we're asking for LHJs to only submit 1 SurveyMonkey per LHJ. So once you're done, once you click done, that's when you actually submit the survey. So if you don't click done, it's not going to be submitted. You have to click on that and then it'll say, thank you for completing the survey. So that's just a quick little run through of the SurveyMonkey, and I'm going to stop sharing, and Selena, if you can pull back up the slides for me. And you can go to the next slide too, please. So next, I want to share some of the strategies we heard from LHJs when they completed the baseline assessment. There is no specific way to complete the assessment. We didn't give LHJs any directions on how to fill it out, since what works for one LHJ may not work for another. And so, like I mentioned, we sent out a Word doc version of the assessment, so you can use that to leverage the survey and add any specific questions your LHJ is interested in learning about, and then sending that to your all staff to complete and then analyze the results. And then you can fill out the SurveyMonkey with your average scores. So if there's anything you're interested in that we're not covering, it's a great opportunity for you to add something into that SurveyMonkey in the Word doc version. Another strategy is to conduct key informant interviews with staff from different programs and position levels. And then the same idea too is conducting some focus groups with different programs and position levels. And then lastly, we heard from LHJs that they also held an agency or department meeting and did polls to allow everyone to individually vote. And then they completed the assessment by answering based on the majority of vote or the average. So now I want to talk about if your LHJ would like to change methods on completing the assessment. So we highly encourage LHJs to use the same methodology from one year to the next. But if there's not bandwidth, for example, to keep the same methodology, or there's an increased capacity to have a more comprehensive approach to completing the assessment, then please describe the change, the reason for it, and the new methodology used. And that can be added in that final question of the assessment where we asked you how your LHJ conducted the assessment. So while changing methodologies can skew the data, we want to acknowledge that this isn't meant to be a scientific study. Changes to methodology will be noted as a limitation to the validity of the 2023 results. And our main objective here is to capture the progress of each LHJ. Next slide, please. So now I want to go over some key dates. As you all know, we released the SurveyMonkey on April 24th, and we sent you all an email with the link to the survey, along with the PDF version and the Word doc version. And then we also attached the frequently asked questions document. If you haven't received it, please let us know. We are happy to resend out all those documents and the SurveyMonkey link. So the next thing is on June 13th, we will be having an office hour to answer any questions you have on the assessment as your LHJ starts to fill it out. You may have questions that pop up, so this office hour is a great way to get those addressed. And then lastly, and most importantly, the assessment will be due June 30th by 5 p.m. I would like to remind everyone that it's only 1 SurveyMonkey per LHJ. And since we released this assessment, LHJs have a little over 2 months to complete it. If you would like to set up a meeting with your TA specialist to discuss the assessment, please submit an inquiry in the equity portal. Our team is more than happy to meet with you and help out in any way we can. Next slide, please. And then I also want to encourage you all to review the frequently asked questions document we sent out. It has a lot of great questions and answers that you may find useful since we've added new questions on there. We did go through some of those questions throughout the presentation today, but I want to highlight the first question on this slide, which is, I received my baseline organizational assessment results. How can I use them to fill out the assessment? Well, they can be used as a reference point to reflect on how your LHJ addressed itself and the work that has been done to achieve since then. This can be helpful for new equity leads and hire staff after the baseline assessment was completed, who will be taking the lead on filling it out this time, and it's their first time. So it's a great way to look back and reflect. If you do need us to resend those baseline assessment scores, please reach out to us. We're more than happy to send them to you. And next slide, please. So now we're going to open it up to any questions you have. Feel free to raise your hand or put them in the chat. I also want to invite Rohan, Stephanie, and then members of OPP and the rest of the TA team if they want to help and answer any questions as well.
Thank you, Claudia. And I'm going to actually pass it over to Rohan for a quick comment just before we
sure.
start the Q&A, and I'll open mics in the meantime.
Great. Thank you so much, Selena and Claudia, for walking us through this. I wanted to make a few comments before we join a broader conversation with all of you. This is another reason why this assessment really matters. You may have heard us describe our strategy of normalize, organize, operationalize, and we're adding to it this fourth element of visualize. This assessment is really the foundation of all of that work and that strategy. A lot of you have new staff. There's been new hires. We've all had turnover at the state and local level. So people frequently say, what is equity? What do you exactly mean by that? It can be amorphous or fuzzy. The field gets critiqued often because of different terms and interpretations. So we took 3 surveys that were out there. We took a lot of your feedback. We put a lot of heart and thought into describing these domains and competencies and definitions. And I think it really helps normalize for our teams and staff as they change and grow over time. So I think the assessment isn't just an assessment. It's not just a quantitative or qualitative tool. It is part of a broader strategy of bringing us together around normalizing. Organizing as well, I think it keeps us focused in a very systematic way around domains and competencies, and helps us be able to articulate that to our leaders and others. Hopefully the results are useful for you all at the local level as you're interacting with other partners and leaders as well. And as I've shared, other sectors, even outside of health, have been inspired by this. The California Healthcare Foundation is trying to do an equity landscape analysis, and they actually borrowed from the same assessment because it's so thorough and descriptive in its categories for organizing equity work. And finally, operationalizing. That's where we get to the, did we move the needle on this goal or this domain or this competency? So I think there's multiple benefits. And then finally, visualize. It helps us be able to see with the results on an annual basis if we're moving the needle. So I just wanted to say, I know it's work to look at the survey, to try and get the response rate, to participate and get your localities and leaders to engage, but it serves a lot of other strategies and benefits that I just wanted to name. The second point that I wanted to make is that it's okay if you do want to choose a new methodology. That was our first year of doing it. We had different levels of staff. Some may have had one person fill it out and not the group. So if you do want to pivot, that's okay. As was mentioned, we're not concerned about the same methodology. We want to get it right and what that means for you. So if you want to host a meeting in mid-June and have different staff give input that's more inclusive, and that's what you plan to do moving forward, because maybe you have a little more bandwidth now, that's fine. Just explain that to us, and we hope for more consistency moving forward. There is no singular way or right way to do this. We really trust you in being the experts of your local jurisdiction and teams in order to do it. So that's okay, but for our awareness, so we can just describe that pivot, just let us know. And finally, my third and last comment is the power of the qualitative. We really want you to take advantage of those optional comment boxes. That's where the richness is. It's not in going from a 2.8 to a 3.2 in a particular domain. It's you sharing, you know, we still have this persistent barrier and need help on that. within this competency and domain, or we actually had this success that we want to elevate and share. So naming your successes, your wins, your barriers, and your strengths is really important. So please take this as an opportunity to shine and share both the challenges, but also the successes and wins that you've experienced over the past year at the local level. Thanks, Stephanie.
Thank you, Rohan. You know, we're gonna start strong with a strong question from the chat. I'm gonna read it off. It's from Joanne. Thank you, Joanne. To what extent do we believe that state and local health departments are set up to address the root causes related to the environmental, social, and economic conditions which impact health? Rohan, any initial ideas?
Yeah, great question, Joanne. Thanks. The words that draw my attention are set up. I think many of us believe in policy systems and environmental change. Public health believes in changing the conditions to set the stage for healthy communities and populations, and getting set up in order to address those root causes is really the infrastructure journey that we're on. So if you look at the 12 competencies, some more than others focus on addressing root causes through policies and procedures, through community partnerships, through partnering outside of health, because we know many things outside of health affect health, and we may not have total power and control over it, but need to be able to influence it by having leads that have the expertise and the time to work on the county general plan, to partner with the other county departments on addressing those root causes. So I think the notion of being set up to address root causes is spread out throughout some of those 4 domains and 12 competencies. And you may view it slightly differently, but I hope in your answers, you can name how you're approaching that within your locality. And you may go a little deeper as you answer the 12 particular competencies. But I think that's what we're all here to do. And we're here to get better set up in more of a sustainable way. We don't want this to be a pendulum swing, you know, with bioterrorism, with other things. There was an influx of funding and then it went away. We had teams that were stood up and then they disappeared. We don't want that to be the story of this pandemic era. We want it to be a win in terms of being permanently set up and continuously improving our strength and capacity in being set up to address root causes. Great question.
Thank you, Rohan. Another one that I received directly. Accreditation requires an equity assessment that considers staff competence in areas of cultural humility, diversity and inclusion, etc. Are you considering development of this by any chance? I'm going to take a stab and then open it up to whoever wants to add in. So what we have seen with the assessment and what we have provided is that you can tailor it to make it your own. There are no plans to change and add competencies at this moment. This is our 12 competencies of equity infrastructure for now and for the near future. But what we have seen and what has been done in last year is there has been modification, so you can leverage the survey, make it your own, and have it serve that purpose of accreditation and adding that cultural humility piece among others that you're interested in receiving from your staff. So there's 2 ways to do that. You can do that by modifying the Word document, or you can even do that if you have a SurveyMonkey account by asking us for our SurveyMonkey, and we can transfer that over to you. You can add the competency or other questions that you desire, and you can distribute it that way. So even if this isn't particularly the full competency that you're looking for, you can make it, and we do encourage that. I'll stop there and open it up.
Yeah, if I can build on that, Stephanie, the last thing we want is a redundant survey. We're all suffering from survey fatigue. We want this to also meet your needs. We believe this will empower us to continue to fight for more resources at the state level and hopefully support you all at the local level as well. And we know there's other requirements, like you mentioned, accreditation. So if you can use some of the answers from this for other required reporting that you need to do and or accreditation, by all means do that. If you see synergies for the future, let us know with comments on it so we can consider baking that into future versions. And as Stephanie mentioned, we're absolutely willing to share the base version so you can build on it and add flexibility. So if you are having a convening and you also want to add a few other things to take the pulse and survey within your local health jurisdiction, you can do that by all means. You know, federally, there's this notion of class standards, CLAS, culturally and linguistic appropriate services. And many of you have built out accreditation teams. So I think it's a great conversation to make sure it could potentially meet multiple needs at the local level.
We have one more question. Thank you, Daniel. Might you suggest we use the 2.0 survey and or analysis to discuss how this work's trajectory in our LHJ looks like from the standpoint of 2022 during the declared public health emergency era with all the funding and priorities that went with that versus now, where there have been considerable shifts in public health funding and priorities?
Yeah, thank you, Daniel. I think that's a very strategic way to consider using this survey in its second year. The shift to an equitable recovery is a big conversation. I just came from a Capitol Assembly budget hearing yesterday where Assembly member Dr. Arambala from the Central Valley and Dr. Jackson from Southern California really didn't want us to lose sight of what the pandemic reminded us of and continue to be able to advocate for policies and resources, including for local public health. And so if the survey results you believe helps you articulate how you've made progress, that there's still ongoing work that needs to be done, how you need to build out your teams to grow in other competencies, by all means. I think that would be a great strategic use of it to advocate for more sustainability and for sustaining certain positions or even growing them. And I think with ongoing technical assistance, and as this community of practice continues to meet and convene, we can share how we're using this assessment to advance the work in our local levels. I think there's a lot to learn between jurisdictions like you're bringing up.
Thank you, Rohan. And I think we can share many of the best practices or even just ideas and innovations that we receive from this 2.0 version. I was really impressed by one LHJ who said, you know, we're taking this assessment and we are integrating it into our RFPs with our community-based organizations. And it's going to be part of something that, you know, as a subcontractor, as a CBO that's working with us, they will also take the assessment. So a lot of strategies, a lot of ideas, and we can share those out in a 2.0 report as well. One more question here in the chat. Last year, the struggle for our team was the position of ratings 4 and 5. Our team felt that fully achieved is showcased with their evidence with the evidence of use. Any thoughts on adjusting the rating? This is tricky. There has been a lot of discussions on adjusting the rating, actually, even in terms of adding some 0.5 increments. At the end, we did decide to leave it as is to gather some consistency in the process. I think something that's really important is how you interpret it varies as well. All of the examples that are in the assessment, they don't all have to be fulfilled A 4 doesn't mean that all the examples in the 4 category have been accomplished. The same with the 5 or the 3 or the 2 or the 1. It's more to give you ideas of the type of work and for you to say, you know, we might not be doing any of the examples in the 4, but we're doing work that is similar and that makes us feel like we are in an advanced position in our equity journey. We know that there's going to be ambiguity, but you know, we ask that you try your best and that you use that qualitative optional box to really explain why you chose the 4 or why you chose the 5 or any other number. I hope that helps a little bit, and I open it up for any other opinions or thoughts there. More than happy to continue that conversation as well. Looking for any other hands, feel free to unmute or put your questions in the chat. We are here and also happy to give some minutes back if there's no other questions or comments. Giving just one more moment of an intentional pause to see if there's anything else, and then we'll wrap up. Okay, thank you everyone so much. Thank you, Dr. Radhakrishna. Thank you all for being here. We will see you next week in our office hours to talk a little bit more about internal equity infrastructure within CDPH. Thank you all so much. Make sure to send us an email if you have any questions, and have a great one. Thank you.
Thank you.